Well, I suppose we can go ahead and get started. Just a heads up, we are recording this meeting and we'll share it later. So I know some of you may have colleagues they weren't able to join, but you're definitely welcome to share this after, and we'll get a link out to you later this week. Um, but anyway, so welcome to our Burrows Consulting Mastering Board Leadership webinar. We appreciate you being flexible with time today. Um, as you can see, we're joined by Genua-McDaniel of Genua Consulting. Jen is a founder and CEO of Genua Consulting. In 2005, she immigrated from Canada to the United States to work in a community health center. With 18 years of experience, including 8 years as a CEO, she brings extensive expertise in operations and governance. Jen collaborates closely with the Bureau of Primary Healthcare, participating as a reviewer for operational site visits and providing training and technical support to community health centers and primary care associations. Her unique perspective, gained from serving as a former health center board member, enables her to guide boards towards becoming generative and effective. Today, Jen joins us to share her expertise on board leadership and effective board recruitment strategies from many years of experience in health center leadership. And we hope you can take this and use it and implement it in your own organizations. So with that, I will turn it over to Jen.
Awesome. Thank you, Kate. Hi, everyone. I love that we're a small group, so that way we can have some great conversation. I come to you from way of Omaha. I was on my health center board, finished my tenure, and I used to chair the audit and compliance committee. So I don't know if we have board members are on or senior leadership, but it's nice to be on the health center side. And now I got to experience being a board member for over 4.5 years. So today we're going to talk a little bit about effective meetings and membership recruitment. And I'm also hoping to learn from all of you. So really have this interchange of encouragement. And so it's a new year. Hope everyone's 2025 is starting off on the right foot. And we're really going to talk a little bit about strategies for effective board meetings and then maybe some best practices for board member recruitment. So before we go into that, as you know, and hopefully if you want, I know that Kate, you're going to be probably sharing this, the presentation, right? The PowerPoint presentation. Great. So that way, if you want, you are more than happy to use this with your board members. But when we think about our health center boards, we know that number one, it is the essence of our health center movement. I talk about this all the time. It is part of our HRSA, regardless if you're a lookalike or a full Section 330 funded health center. It is written into federal law that we must have a board. And when we think about what our mission and vision is, having a board is part of our movement. Not only is it a requirement to keep our federal designation or our funding, but when we have that patient majority board members, it really helps to ground and really learn about the needs and also to hear from the perspective of the community. So HRSA really puts a focus on that 51% have to be patients of the health center. We also want to make sure when we think about our board of directors that the mission and vision of the health center is carried out by the team. So we know that the CEO or the executive director is the only employee of the board, but then in their area, they also oversee their staff to provide that oversight. And then finally, as a board, we need to make sure, especially in kind of the influx of healthcare landscape that we're living in today, we need to remain adaptive and really be able to change, especially with the changes that we may or may not have in healthcare policy, future stability. And we really want to be open to that kind of generative thinking while still maintaining that compliance focus. So really thinking about our health centers. As we know, we're having a lot of workforce shortages, thinking about all the federal dollars that we got with the COVID cares, those have gone away or are going away. And so we really want to be nimble. And that's why we want to focus on that at board of directors excellence. So when we think about our first thought about efficient and effective meetings, and I kind of want to stop here and hear from you all how really the board, the first entry into that is really for them to get their board packets. So how far in advance does your health center provide the board with their packets? And it's okay if you say 48 hours, I'm okay with that too. I just need to know. So feel free to come off mute. You can write in the chat. Jennifer said 5 days. Great. Anyone else? Sandra, I saw you came off mute. If you want to say
I
anything.
was going to say anywhere from 1 to 4 days.
Yep. You know what? And sometimes that happens, right? So when we think about our health center, at the end of the day, we're trying to see patients, right? We're trying to get things done. It's a lot of work to work in our movement and to work in a health center. And so, 1 day, 4 days, 5 days, I always tell health center boards that you want to make sure, and even the leadership, right? We want to make sure that they get their board packet in time to be able to review it. And so when they get to the meeting, they're able to have that discussion. And so the goal is for them to be able to review their documents before they join the meeting. And sometimes I hear, how sometimes you put your board packet together, you send it out, and then you're like, oh my goodness, I need to add one more page or I'm missing a report. That's okay. As long as they get that meat of information, especially if you're working maybe on a policy or you're applying maybe for some new access point funding or another grant funding. We want to make sure that they get the meat of their material at least ahead of time so they can really review it so we can have some more efficient discussion. About 60% of the time should be spent in discussion versus staff reading the reports. And again, if they get their information ahead of time, they should be able to have that discussion. Sometimes it's really hard, especially when you have staff come to your board meeting and then you're like, okay, can you please present the finance committee report? We really want our interactions to be kind of a discussion, not kind of like, your head down, finances said this, our cost per encounter is this. We really want to be able to summarize and really discuss those reports. And then, as you know, making sure one of the requirements is to really capture that discussion and the actions that we're doing in the board, really to capture that in the meeting minutes. So if you know that when we think about compliance and HRSA, Chapter 19, Board Authority, it's that element C where it asks, has the board had the discussion on did they approve the CEO performance evaluation? If you changed your hours of operation, did they approve it? And then HRSA actually goes one step further. So if you go to its question number 7, what it actually say is, okay, if the board has done all of these things, have they had a discussion based on the performance? So what that means is when we look at clinical data or finance data, what is the meaning behind the C-suite team presenting information? So for example, if you have asked to change, they approve the hours of operations, what is the meaning behind it? Did you do patient surveys? Was there a survey? Are you having workforce challenges? Are you trying to extend hours because it's a barrier? You have a lot of maybe working individuals that need some later hours to come. So really kind of thinking about the requirements that HRSA have for us as health centers, that's just kind of the floor. That's the foundation. So we really want to think about what is the meaning behind those requirements. And so being part of having that efficient and effective board meeting that's where we want to provide kind of that discussion and give meaningful information. So clinical and financial data in a method that supports decision making. So what are some ways, I'm just curious, how does your health center board, how does the board get their information? Do you give reports? Do you do graphs? How do you provide that information? And feel free to just put it in the chat or just come off mute.
I know I've got some people that are fancy and they have iPads, but my boards have never been that fancy. I've always had to give email packets or things in
No.
advance,
Yeah.
but always trying to put things in color. I learned that helps a lot of people.
Yes.
Then I had some board members that were color blind. So I had to put things with different things, like with dots and with different graphical things.
Yep. Yep. And I see Tania said dashboards via paper. Absolutely. And the way to kind of understand, or maybe it's to ask, I know I put ask questions, and that's what we want to do, is not just through our, we do employee surveys, but do a board evaluation. How do your board members learn? So I work in the Pacific Islands, and so in the islands, sometimes we don't have a written language, it's a verbal. So when we present information, it is not written down. So really thinking about our board members and the method of learning, how they receive information, I think it's really important to think about that.
The garbage out.
So great. Any other thoughts as to how you provide? Elizabeth, I'd love the idea of graphs. If you're providing it, make sure it's not like a 2.0 font. I know I don't have my computer glasses on, but sometimes I can't see very well. You want to make sure that it's easy to read. And if making sure that also the one thing is that your board members feel comfortable asking questions. So when like I said, I just finished the tenure on my board here in Omaha, but I have to tell you, even though I was a CEO for a number of years, I was really nervous to ask questions at the board meetings because I didn't want, people to think, oh, she's stepping in the weeds, or, I wasn't understanding a certain financial dashboard. And so I realized that if I had that question, I wonder how many other board members had that question. So really making it kind of a safe space for board members to be able to ask questions. So that's kind of my thing when I tell health centers is making sure that your board members really feel comfortable to ask questions. So another way, because I'm seeing a lot of this as with my work, not only through HRSA, but through private clients and working with Burrows, with Elizabeth and her team, is sometimes we're seeing health center boards that actually are not using committees. So yes, it is not a requirement that HRSA says that you have to have committees of the board. It may be a state requirement or a nonprofit law, but it really isn't a HRSA requirement. And so as we talked about earlier, right, the requirements that HRSA has for us is the foundation. It is not the ceiling. So your committees, I'm curious to hear, what committees of the board do you have? So feel free to write it in the chat or come off mute. Like, what committees do you have?
We have an executive committee that doesn't really meet very often.
Right.
We have a finance committee that meets quarterly.
Great.
And we have a personnel committee that meets when it's time to add board members or, and our quality, we have a quality committee, but that we don't have board members on that. Mm-hmm. I don't think they would really understand. I mean, I don't think they would understand how to navigate that. We give them reports. Good. And they have said we don't want to be on a quality committee. We would rather you tell us what you're doing and kind of explain it. So, yeah. And it seems to be working fine.
I love it. I love that because remember, and I always say this, one health center is one health center, and we have seen hundreds of health centers. And so if that works, Sandra, for you, that's fantastic. Yeah. I know, Jennifer, you said executive, finance, personnel. Absolutely. And remember, so I'll give you an example. In New York State, for health centers in New York State, the New York State law mandates that they have to have an audit committee. And it has to be separate from finance. So think about, right? Every state is different. And so, like you said, it all depends for your health center. And really, the goal of executive committees are kind of twofold. We're going to talk about how we can recruit from them, but it supports that overall effectiveness of the board because it's where all that work is completed. They kind of dig into issues. So, for example, like you said, a finance committee, maybe that's where they go through all the credit card statements. You go through all the accounts receivables and the accounts payable. And so then you take all that information, your finance committee or the treasurer or, you know, whoever that you've designated, they put that report in a dashboard and then they provide that to the board. So very similar kind of to quality, right? You have your quality work plan, you have all your clinical measures. That's where you kind of do all the work, your plan, do, study, act, your PDSAs, right? Figuring out what's going on with your measures. And then you have a report and you present that to the board. And as long as the board members, when they come to the meeting and you have that discussion, that you're having the discussion, it's not just a written report. Because what ends up happening is when I'm doing operational site visits and I go into the governance meeting and I have a discussion, I'm going to ask the board, you know, what information do they get? You know, how do you get enough information for decision making? Tell me about your UDS metrics. So really making sure you're doing those works in committees and then kind of having that discussion. Great. And then it really is up to the health center to decide not only what committees, but also whether you have a standing committee, like you said, it meets monthly, meets quarterly, or it's ad hoc. It meets whenever it's up to the health center. So an example of this would be a capital campaign. Maybe you have a fundraising committee. Or a facilities, maybe you're building a building and you need an architect or a facilities and a banker where you can develop these ad hoc committees that you can create. And as long as they're in your bylaws, that's the other thing, your bylaws is really like the laws of your health center. So making sure that you allow for ad hoc committees. So the other thing we talk about is recruiting board members. And as you know, before we can recruit board members, we need a board matrix. And this is a sample that I have. And in fact, I gave it to Kate. So after this presentation, Kate, I know you're going to send out the PowerPoint, and this is an attachment you can use. Actually have it in Word document so you can play with it as you need. But a board matrix, it's really used to figure out what the gaps are in your composition and help recruit. So what you want to see is where your gaps are, because you know HRSA has some requirements that you need for your board. And it also helps to ensure that your board is diverse, it's aligned with the requirements, and also really thinking about your mission and vision. Okay, so that's at the end of the day, that's what we look at is what is your mission and vision, and does the board and even the makeup of the board support the work that you're trying to do? So as you can tell, the HRSA requirements are we're looking at a patient board member that they match the needs of the community. So really looking at your needs assessment, that's where your needs assessment comes in, looking at the zip codes on your Form 5B, and then looking at your board of the patient and not patient board members and making sure that they kind of match. So there's kind of some areas when it comes to board member recruitment, because I will tell you, I get asked this all the time. And if I wish I had the golden answer, I would write a book, but I can't because as you know, one health center is one health center. So here are some ideas that I have seen across the country as some best practices and what I saw when I was on my health center board. So number one, I would say is in-reach. We talk about outreach, but there's in-reach. So really asking your staff, because I'm going to tell you who knows your patients better. Those front desk representatives, the providers, your referral arrangement, your promotoras or your community health workers, they know your patients and the value that they place on your health center. So I would start number one by asking your health center staff. So you could maybe talk about it at your staff meeting, your huddles in the morning. They also know, especially if you serve a percentage of patients whose preferred language is not English, that's something that you want to make sure that you have a variety of board members that can give that voice to your population. You can have flyers in the exam room. I've seen that in public areas, in restrooms. I know that sounds a little silly, but restrooms are a great place. Have your board members the application, maybe not only in English, maybe in Spanish, maybe in Tagalog, whatever that looks like for your health center and your service area. So number one, staff, is that's where and when I was a CEO, that's where I started, is I asked my front desk. 2, existing board members. So we want to make sure, as you know, we don't want to stack the board with all of our board member friends, right, on the board, but we really want to think about, that's where that matrix comes in, because your board knows the community. They are advocating for the services and health centers that you provide. And so when you look at your board matrix and you're looking at your makeup of your board, you kind of know where you have to go next. So that's my number 1, is inReach. Here's an example of outreach, and this is one of a health center that actually this is a flyer that they've put out. Not only it's in English, but in Spanish, but they have this as a photo when you first walk into their clinic sites, and then just lying around. And so they actually also use social media. So Facebook, I know maybe a lot of people don't use Facebook anymore, Twitter, I guess, YouTube, whatever your website looks like. Think about your patients and how you communicate with them. And I'm going to tell you, a lot of it is word of mouth as well. So especially in communities where maybe like the written language, you're not using a lot of writing or mailing things, WhatsApp would be a great idea. In the Pacific Islands, we use WhatsApp. We need a few things. I'm looking for a board member. Kind of, you can spread that out in your, even in your Facebook groups. And don't forget to have outreach in other preferred languages, okay? I think that's really important, especially if they're on your board. You can provide the board packets in a preferred language. So that's also encouraged as well. So this is an example of a flyer. If you want to use it, you're more than welcome to. You can tailor it to your health center need. The other area, and the reason why I talked about committees, is I've been seeing a lot of health centers that actually use committees as a recruitment tool. HRSA allows you to have non-voting individuals or advisory members on your committees. So they can sit on your committees, and then they can also provide, as you know, valuable insight to assess what's happening with your board. So for example, maybe you're building a building and the hospital CFO wants to participate, or you want that hospital CFO on your board. 1, it can help with collaborative relationships. And 2, those individuals, regardless who they are in an advisory role, learn about your health center. Because if you think about it, commitment as a board member is a lot. So however many hours a month, if you sit on committees times the number of years you've been on the board, that's a huge commitment away from your family. So when you start small, when we're thinking about committees, you can have individuals on committees, and then when you have an open slot in your board, that's where you can pull from. And so that's really something to think about, because they're more apt or more inclined to join the board, because now they're kind of seeing how you're functioning, especially when it comes to a committee. Maybe they can sit on your finance committee or quality committee, right, within the board. As a disclaimer, you want to make sure, obviously, that they sign confidentiality and conflict of interest statements, but really that could really be a way. So I'm curious to hear a little bit as well, and what are some ways your health center has recruited in the past? And Elizabeth, I agree about that. You can see if they actually show up and participate. So they're participating in committees, you know that they're going to want to spend that time to officially come to the board, because we're also having a problem across health centers just in general with participation, making sure board members show up. So I'm really curious, what are some ways your health center recruits board members? And it may be what we've already talked about, just really curious. So what I'm thinking too is as you're thinking about this, think also about, and even for those that are probably listening to the recording afterwards, there's no right or wrong way to recruit board members. So maybe you're at a coffee shop, or maybe you're somewhere shopping at a store, and you never know, especially, and it's all dependent on your board matrix.
We asked a lot of we go amongst our staff, and
Yes.
because they know the patients. And we also ask our board members. And I would say too that in our outreach, we kind of keep our eyes and ears open for potential good board members there too.
Absolutely. I love that, Sandra. Thank you. I just saw some stuff. Yep. Some of the perks are enticing. Absolutely. So think about maybe you can feed your board members. Don't forget that HRSA also allows, if you look, there's a footnote in chapter 20, board composition. I think it's footnote 11. Do not quote me. So I play in the footnotes, unfortunately. Is that anything that's considered a barrier to be on the board, you can reimburse for. So think about, maybe we have board members that want to join but can't get to the health center. We can reimburse for transportation, childcare. Maybe you want to give board members an iPad. So absolutely, really think about some of those perks. I love what Jennifer's, asking staff members, board members. So exactly what all of you said is really kind of thinking about, where do we want our boards to come from? It really is, that 51%, that's the minimum requirement. Wouldn't it be great if 100% of our boards were health center patients? So really just something to think about. So when we think about next steps, really think about, number one is doing a self-evaluation of our board. So we ask our patients to do satisfaction surveys, right? We want to do a satisfaction for our employees, but what about our board members? So we want to really do a board evaluation to support that decision making. If you don't have a board matrix, I would strongly encourage you to do one. I would say that the board matrix is not the same as that, that Form 6 board characteristics that HRSA has you fill out. I would compare that and then do an actual board matrix to see kind of where the gaps are. And then finally, you can do a board recruitment plan. I see a lot where in strategic planning, you can have a governance section where you can talk about, we want to develop a board matrix or a recruitment plan. So really encompassing that, because at the end of the day, it's really that, again, we go back to, right, our health center mission and vision. So just something to think about. So Kate, I think that was it for next steps. I wanted to put some resources here. And then finally, if you have questions, Elizabeth and I work very closely together, work with Burrows. So feel free to drop something in the chat, or Elizabeth, I know they can contact you. So Kate, I'm going to turn it back over to you.
Yeah, thank you so much for everything that you shared. And thank you everyone for participating in the chat and hopping in a discussion. I know it is 4 o'clock, so I don't want to take up too much of your time, but you're welcome to stay on if you do have other questions, and we can address those. And if not, if there are questions that you still have after this, please do feel free to reach out